What happens when you take a multiple sleep latency test, MSLT? Imagine waking up after a good night's sleep and then trying to doze off again during the day. That's exactly what the multiple sleep latency test is all about. It's a special test used to see how quickly you fall asleep during the day and whether you enter REM sleep, which is the dreaming stage. This test is often used when doctors are trying to figure out why someone feels excessively sleepy during the day. It's especially helpful for diagnosing conditions like narcolepsy or idiopathic hypersomnia. If you have sleep apnea, your doctor might suggest this test to see if your daytime sleepiness is caused by your sleep disorder or something else. Before you take the MSLT, you'll need to do an overnight sleep study called polysomnography. This measures your sleep quality and how long you sleep in a lab. The MSLT always follows this overnight test, usually about 1.5 to 3 hours after you wake up. During the days leading up to the test, it's good to keep a regular sleep schedule and track your sleep in a diary for 1 to 2 weeks. On the day of the test, you might be asked to give a urine sample for drug screening and fill out a questionnaire about how you slept the night before. The test itself involves 4 or 5 scheduled nap opportunities spread throughout the day. Each nap starts exactly 2 hours after the previous one. You'll be taken to a quiet, dark room similar to your overnight sleep environment. Sensors will be attached to your head and face to monitor your brain activity, eye movements, and other body signals. Before each nap, the technician will check that all sensors are working properly, often by having you open and close your eyes for about 30 seconds. Once everything is set, the lights go off and you try to fall asleep. When the lights go out, the test measures how long it takes you to fall asleep. This is called sleep latency. If you fall asleep, you'll be allowed to sleep for up to 15 minutes so the technician can see if you enter REM sleep, which is linked to dreaming. If you don't fall asleep within 20 minutes, the trial ends and your sleep latency is recorded as 20 minutes. After each nap, whether you sleep or not, you'll be awakened and asked to stay awake during a break. During these breaks, you should stay busy with quiet activities and avoid caffeine, smoking, or vigorous exercise, as these can make it harder to fall asleep again. The entire test usually takes most of the day and ends by mid-afternoon. Each nap trial can last between 20 to 35 minutes depending on whether you fall asleep and how quickly. Once all the naps are done, the sensors are removed, and you're free to leave. The results will tell your doctor your average sleep latency across all naps and whether you entered REM sleep during any of them. If your average sleep latency is less than 8 minutes and you enter REM sleep in at least 2 naps, it might suggest narcolepsy. If it's less than 8 minutes but with only 1 or no REM episodes, it could point to idiopathic hypersomnia. For those with sleep apnea, the MSLT helps your doctor determine if your daytime sleepiness is mainly due to your breathing disorder or if another condition like narcolepsy is also involved. Sleep apnea causes poor sleep at night and less oxygen, which makes you sleepy during the day. But sometimes, other conditions can cause similar symptoms. The MSLT provides clear measurements that help your doctor decide the best treatment plan. Whether it's adjusting your sleep apnea therapy or exploring other causes, this test gives important clues to improve your daytime alertness.